The effects of increased patient education on medication compliance in rural adult mental health patients. This is by Evelyn Mullins, NSC 890, Synthesizing Evidence for APN. On a national level, Healthy People 2020 identifies mental illness as being a leading cause of disability in the United States and one of the largest disease burdens here. To further highlight its importance, 1 of 4 people in the U.S. have dealt with a mental illness in the past year. In 2014, the state of Kentucky identified 7 health goals to work toward during the next 5 years. One of the goals was to reduce the number of poor mental health days by 25% in Kentucky. In order to reach these goals, medication compliance for people in rural settings with mental health issues must be improved. Psychiatric medications must be taken on a continual, regular basis. It is imperative that mental health patients are taught the importance of medication adherence, and medication compliance methods are identified and utilized by practitioners. Advanced practice nurse practitioners should develop and implement additional patient training and ongoing patient education to ensure patients have the best knowledge regarding medication compliance. The purpose of this literature review is to examine the effect of increased patient education on psychiatric medication compliance. Zhao and Gu 2014 compared effectiveness of enhanced care, which included additional healthcare team members and health promoting activities with usual treatment in rural areas. 6 villages in Bangalore were selected for study participation because of proximity to a healthcare center. 260 adult women were randomized into the study. Demographic and socioeconomic information was attained, and the participants were placed into an intervention group in which they received additional patient education or into a treatment as usual group. Variables included number of participants who completed the treatment, duration of antidepressant treatment, treatment visits attended, and changes in depression severity, which were measured using the Hamilton Depression Scale, and changes in quality of life measured using the BREV scale. After 6 months, the study revealed that women in the treatment intervention were more likely to complete treatment or comply with the medication regimen longer than those in the treatment as usual group. There was no significant difference noted in severity of depression or quality of life. Limitations of this study included no formal sample size or power of the study calculated. Pradeep, Isaacs, Shanbag, Slevin, and Srinivasan 2014 examined effectiveness of self-management training on medication adherence and relapse in psychiatric patients. 201 individuals living in Shanghai were randomized into either a control group or an intervention group. The intervention group received weekly self-management skills training and medication education for 6 months, followed by 24 months of monthly group booster sessions in which a community health worker reviewed patients' self-management checklists. 2 psychiatrists who were blind to the treatment status of the patients assessed adherence to medications using the Moresky Medication Adherence Scale and Personal Illness Insight using the scale to assess unawareness of mental disorders at baseline and 30 months after baseline. At the 30-month follow-up, the intervention group was determined to have an increased medication compliance rate. There was limited research that specifically targeted mental health patients living in rural areas. Both studies focused on increasing patient education and devoting more time to patient teaching. The methods in which the additional education was provided did vary between studies. Zhao and Gu implemented a separate care team to provide additional education to patients throughout the course of the patient's treatment. Pradeep, Isaac, Shanbag, Slevin, and Srinivasan provided weekly skills training to ensure that patients had the skills needed to self-administer and comply with psychiatric medication regimen. Both studies yielded positive outcomes despite delivery method of patient education. Providers should develop an evidence-based practice-based intervention for psychiatric medication compliance. This plan should include providing increased assistance and patient support to all mental health patients, and providers should also ensure that patients understand the importance of adhering to a medication regimen. Utilizing the findings of these studies to improve nursing practice related to psychiatric medication compliance would be beneficial. These findings would be easier applied in a clinic setting by an advanced practice nurse. As indicated by the reviewed studies, increased patient education yields an increase in medication adherence. This additional education can be provided by the practitioner or any other clinic staff. Implementing extra healthcare team members to provide additional education and support to mental health patients would be beneficial in improving medication compliance. More time and emphasis should be placed on promoting medication adherence. Ensuring the patient understands the importance of taking medications as prescribed is imperative to successful patient outcomes and the therapeutic effect of psychiatric medications. Ongoing education regarding medication compliance should be maintained to ensure the patient continues treatment.